You've heard it many times.
Hello viewers and welcome to another interesting edition of the program Health Talk on Al-ansar Tv. I am Tahir, Musa, Naggo. Health Talk is a dedicated source for wellness and health information. Today on the program we have a very special guest. He is a consultant ophthalmologist and the CEO of Spectacular Eye Center. He is Dr. Tunde Owoyele. You're welcome on the program, Doctor.
Thank you very much, Mr. Kai.
Today on the program, we will be talking about cataracts. Most of you have heard about cataracts, or you've seen one or two persons' eye problem. But before we get to the main topic of discussion, we would like to know a little about our guest.
Thank you very much. My name is, like you said, Dr. Tunde Owoyele. I was born in Kaduna, but grew up in Jos. And I went to Corona Primary School. Then subsequently for secondary education, I went to Titcomb College. Titcomb College is in Egbe. Then I went to University of Ilorin for my bachelor degree in medicine. Subsequently became a fellow of West African College of Surgeons in ophthalmology. Proceeded to University of Cape Town for postgraduate diploma in community eye health. Briefly.
So, like I introduced, our topic is cataract. Doctor, what is cataract?
Cataract is an opacity of the natural lens. That is, every eye has a transparent lens. So when it becomes white, it's what we call a cataract.
Like cloudy.
Cloudy, yeah.
Okay. So what are the causes of this cataract?
Okay, so cataract can be caused, we can divide it into congenital or acquired.
Okay.
Congenital causes are the ones that you're born with, and then the acquired ones you develop later in life.
Okay.
The congenital ones can either be due to maternal infections. Some people in the families, they have familial ones or hereditary ones.
Okay.
That is, they are born with that. Then there are other metabolic causes, you understand, like metabolic causes that can cause cataract. Then genetic causes that can cause cataract. And then there are some congenital abnormalities that you're born with that comes with cataract too. So for the acquired ones, the most important one is age-related. People, when they are getting older, the lens becomes cloudy and white. That's the most common ones for the acquired one.
Okay.
So the acquired ones are the ones you develop later in life. With old age, people tend to develop a cloudy lens. That's the age-related one. Then the traumatic one is injuries to the eye. Any injury to the eye, either small or big, subsequently can develop into a cataract. Then you have the metabolic ones like diabetes mellitus. So those are the causes of cataract. Then there are some other congenital, no, not congenital, acquired developmental um, diseases that can develop in cataract.
Okay. So of all these types that you mentioned, are they all curable?
Yes, they are all curable because once the lens becomes cloudy or white, the only thing you do is to do a surgery and you remove them out.
Okay.
Yeah.
Okay. So before we get to the therapeutic,
Yeah.
we would like to know the risk factors that are associated with these cataracts.
Okay, the risk factors, like I said, congenital maternal infections.
Okay,
You
yes,
understand?
yes.
Congenital maternal genetic causes.
Yes.
You understand? Diabetes mellitus, glaucoma. Some of those are some of the things that place the patient at risk to having cataract.
Yes.
Dehydration and things like that.
Okay. So, doctor, we would like to still, or our viewers would want to know the symptoms. How do they know, or how do we know, like me and the other viewers at home, how do we get to know that we have these cataracts?
Okay, the first initial symptom is progressive, painless visual loss. The patient or the person starts to feel that his eyesight is not clear anymore, and it's most times it's painless and it's progressive gradually. Other symptoms the patient might have is glare. When light is shone into the eyes, the patient doesn't like night driving,
Yes.
afternoon driving. Then some people, especially for aged people, when they walk in the sun, they find out that when they're in the sun, they don't see good.
Yes.
But in the evening, it's better.
It's better. Yes.
Then gradually you find out that they can't read. Then subsequently, vision is lost.
Oh.
So those are some of the initial things the patient complains of.
So, do we classify cataract as something that one really needs to like a critical eye problem that when we have it or when we start seeing the symptoms, we need to act fast about it?
Okay, yeah, cataract is very important because everybody doesn't want to be blind. And with this age of increasing literacy, you understand, education, development, modernization, everybody wants his eyes.
Yes.
So you need your eyes to be able to read, to watch, and things like that. So yes, it's something it has to be dealt with early. Especially like I said, for this age and time, people need their eyes for so many things. Not like in those days where there was lack of education and things like that. So people don't really need their eyes at that particular time. So they might get to a very old age when they've lost their vision, then they start thinking, let me do something about it. But now, because of digitalization, things like that, it's something that must be dealt with. That's why therapy is done as early as possible.
So does it get to the stage that therapy cannot even solve it?
Well, when we get there are two modes of therapy, but once it becomes too complicated, there's what we call a complicated cataract, and it leads to other secondary things. Then therapy might not be able to help. Yes.
Wow. So, thank you for that, doctor. So, how do we, or how do, this one is related to you and the hospital. How do you get to diagnose the cataracts?
Okay. The first thing is you take a detailed history. That means you ask the patient what's wrong with it in the symptoms. Then you look for the signs too. And then the first thing you do is do a visual acuity. That visual acuity
Yes.
to test how the patient can see. Then apart from doing a visual acuity, there's something we do, a refraction, that you have to test the power of the eye. A fundoscopy, you have to look into the back of the eye to see what kind of cataract it is. Then you see the back of the eye. Then you do a slit lamp examination to see what kind of cataract it is and if there are any other associated things.
There are some people or some set of people that really don't believe that this cataract is a medical condition that can only be treated in the hospital. I get to see a lot of people that, even though I'm not a doctor, but from what they are going through or what they are, the symptoms they exhibit, it's evident that maybe they are having cataract, but they prefer to visit all those local or traditional medicine men or all those ones or working vendors on the street to get this cataract. I think I've seen one myself, one doctor that he removes cataract without surgery. He will apply something in the eyes and then he'll put a cotton board by the side and be rolling it, and you'll be seeing something coming out like thread-like. So what do you have to say about those kind of
Okay, well,
individuals?
Those kind of individuals, well, sometimes they don't have any option, those people in the villages, but it's not the right way, because eventually they develop complications. There's what we call couching. They can use a sharp object to dislodge the lens, and the patient sees because the lens has been dislodged, but they use a sharp object and dislodge the lens. Some put herbs and chemicals on it so that it tries to dislodge the zonals and things like that. So it might give an temporary relief optically, but eventually it leads to so much complications. And apart from that, I must say that even on the internet, there are so many things. You see, somebody called me this afternoon that, no, this morning, that there's one drug he saw on the internet. It cures everything for the eye. You understand? And that's not
Just
even
one drug.
yes, that's not even traditional. That's on the internet.
On the internet. Yes.
And you wonder what kind of drug will cure. It cures glaucoma, cures cataract, cures eye infection. I mean, most people are gullible to that. Even they're using the internet to.
Yes.
Yeah.
Most people believe everything on the internet
That's
is
true. Yeah.
Yes. So now we would like to go into the treatment options for this cataract. What are the various treatment options that you have or that there are available in the hospital?
Okay, the two treatment options are the medical and the surgical.
Okay.
Then we can say the optical ones to the glasses and things like that. The medical ones, sometimes when it's not mature, you can use some dilating drugs for the patient so that the pupil is dilated way over the lens opacity so that the patient can look rounded. You understand? So people who are still making up their minds or is immature, or they are aged and they don't want surgery, so you can temporize on that. So that's the medical treatment. Then there are some
But
drugs.
it's temporary.
It's temporary. There are some drugs that can, um, when it's very early, prevent it from maturing. There are new drugs now that can prevent. Then the surgical ones are the ones you go in and you take the lens out. And there are different types.
Okay.
We have the small incision surgery you can do. We have the phaco, you can do, and you have the extracapsular cataract extraction. But when we remove the cataract, we replace it with an artificial lens.
Okay.
Yeah. So when you remove the natural lens, you replace it with an artificial lens. You understand? So the you do a refraction, you know what the power of the eye you're supposed to replace, you understand? So that is done before the surgery, then you use it, you get it and you insert it inside.
Okay, I now understand. Because I thought whenever I hear cataract surgery, I thought it's just the clouding, like it is described. Cataract is the clouding of the eye, natural lens. So I thought it was just the removal of the clouding, and then while the lens will just be left there. So it is the whole lens that is removed.
The whole lens
replaced.
And replaced, but you leave the back. There's a capsule behind, so you leave the back capsule there. Then you put the artificial one in there so that it holds it in place.
Wow. Like, how long does this surgery last? Is it a minor surgery, or do we call it a major surgery?
Let's say the intermediate. Let's just say intermediate surgery. Yes, surgery. And 10-15 minutes for skilled people. 10-15 minutes. Yeah.
Maybe we should call it a minor surgery.
10-15 minutes, 20 minutes, yeah, for skilled individuals.
Okay, that's
so fast. Yeah.
Okay.
So it depends on your experience and things.
Okay, that's good. Well, viewers, if you are just joining us, this is Health Talk on Al-ansar TV. And today on the program we have a consultant ophthalmologist, Dr. Tunde Owoyele, and we have been discussing extensively with him about cataracts, and he has said a lot. He has described to us what cataract is, the acquired, the hereditary, and lots more. And he has also discussed about the signs and the symptoms of cataracts. But before we continue, please don't go away. We will go on a short
Al-ansar TV, TV for humanity.
You've heard it many times. back. This is Health Talk on Al-ansar Tv. I am Tahir, Musa, Naggo. And today on the program we have been discussing with a consultant ophthalmologist in person of Dr. Tunde Owoyele, and we have been discussing about cataracts. Doctor have said a lot before the break, so now we are going to continue. So, doctor, before the break, you talked about cataract surgery. So, I would like to, or our viewers would like to know the recovery process after a cataract surgery. How is the recovery process like?
Okay, for cataract surgeries, nowadays the recovery process is very fast. After you do the cataract surgery, especially for the phaco, the small incision, recovery is so fast that the next day you are fine. You can go back to what you were doing. And but in earlier days, the recovery process when they used to do extra capsule, it used to take longer. But now, by the next day, you are doing fine.
Wow.
Just that you have to be on medications for a while. Then you have to have a refraction done at a certain time just to know if you need correction again with glasses.
Okay.
Sometimes you might need correction again with glasses.
Okay. That's so, but it's not in all cases.
Yeah, but it's not in all cases. For every surgery, there might be complications.
Okay.
So if the complications arise, you deal with the complications.
Okay.
But straightforward cases, the recovery process is very fast.
Okay. So, doctor, what about lifestyle changes? Are there any lifestyle changes that can help prevent, or any preventive measures that can help reduce the risk of this cataract?
Okay, like I said initially, there's the congenital, there's the acquired.
Okay.
So for the congenital ones, lifestyle changes is genetic counseling. You understand? Some families have this genetic thing that brings cataract. You understand? So marriage counseling. So that's why marriage counseling, genetic counseling is good. Consanguinity, marrying from the same family, you understand? So you can do a counseling for that so that it reduces the incidence in the family and this. Then maternal child health, you understand,
Yeah.
immunization. So that is antenatal clinic
Yes.
for mothers to prevent risk of infection, you understand, maternal diseases and things like that. So all those things are some of the preventives. So for the acquired ones now, well, the age related usually comes like that. But there are some things that can use. You can do your diet. You have to eat a lot of antioxidants, fruits, vegetables.
Okay.
You understand? So that prevents the oxidative process in the lens itself. Fruits, vegetables, any food that has a lot of antioxidants. Then prevent dehydration. You drink a lot of water. Then prevent injuries, trauma to the eyes. You understand? Control diabetes very well, because those are some of the things. Diabetes can cause cataract. Then some people who have glaucoma, you understand, make sure that the pressure, the intraocular pressure is normal and stable. So those are some of the lifestyle changes you can.
Okay.
Then
So-
reduce, wear spectacles where there's a high incidence of
Rays.
rays, sunlight and things like that.
Okay. So, in every medical condition, so to say, or any medical condition, there are certain misconceptions. So, what are the usual or the most common misconceptions about this cataract thing, and how would you like to address it?
One of the misconceptions that I always tell people is in our locality, you find out that people get old, and the children, the relatives, they abandon them, and they say it's just they associate getting old with blindness.
Okay.
So they just say
So
he's old.
it's old age.
It's old age. So it's natural for him to go blind. But when we do all these community outreaches, we find out that it's not supposed to be so. So we have to educate them that old age is not synonymous with blindness. And some of the common causes of blindness in the world is cataract. And you just do a surgery and the patient can see. So those are some of the misconceptions about it. Then another thing is some people think cataract and corneal opacity is the same thing. So you see some misdiagnosis. They say a white spot in your eye. They say
It's cataract.
it's cataract. It's
Okay.
cataract.
Yeah.
So not every white spot
It's cataract.
is cataract. So that's why you need a trained person to be able to differentiate a cataract from a non-cataract lesion in the eye.
Okay. Viewers, this is interesting, and I believe we are learning a lot from our discussion with our consultant ophthalmologist. Like doctor said, most people associate blindness with old age, and I think, like he said, it's totally not true. Blindness has nothing to do with old age, and old age has nothing to do with blindness. Because I think I have seen a lot of old people that have their eyesight intact. They don't use glasses. The moment they see you from afar, they know who it is and they will call your name. They can read without glasses and all that. So I think we should do away with those misconceptions and come to the reality of things, and make sure we visit a doctor the moment we notice any changes in our vision. And we shouldn't go ahead applying one or two things, anything that comes to us or anything that somebody suggests to us. So, doctor, every doctor has an experience, or one or two experiences that he will forever remember. What are your memorable experiences that you would like to share, maybe about one or two patients that had this cataract that you have managed in the past?
Okay, the best thing about doing a cataract surgery is, especially for people who are totally blind due to cataract, is the best thing that any cataract surgeon will be glad about is the next morning you take off the pad.
Yes.
And the patient smiles at you and say, "I can't see." I think that word is beautiful. You know, it's just like you're giving a new lease of life.
Like bringing someone out of
darkness.
Yes.
Out of bringing somebody out of darkness. You understand? That's, I think, most cataract surgeons will tell you that's the most beautiful thing.
Yes.
You understand? I had the patient many years ago, and she was a Fulani woman, and after I did this cataract surgery for her, she started crying. And I was asking her, "Why are you crying?" And she said, they live in the bush, you understand? These ones are not town. And she told me all these years, when they give her food and they place it on the ground, sometimes she takes the tool and wants to dip it into the soup, and she dips it on the ground.
Oh. Oh,
And by the time she takes it into her mouth, it's sand.
it's sand.
You understand? So she said it has been terrible. Then for people, most people is, you understand, they can now see their faces of their grandchildren
Yes.
or newborn grandchild. You
Yes.
understand?
Or even maybe children that have been
Yeah.
born long ago,
yeah,
but they've
but
not
they
been
never
able to
see
see them.
their faces. So that gives them joy
Yes.
and translates to you, and you feel happy too that you brought joy, you brought life again to this person.
Yes.
So that's a wonderful experience.
It's wonderful.
Just the smile in the morning, the smile, and they look at you and they say, "I can't see." Is enough.
Is enough.
It's enough.
Is enough. That's interesting. So, finally, Doctor, before we call it a wrap, what would be your final advice to our viewers who may be experiencing this same problem of cataract? What would be your final advice to them, and maybe any other symptom of any eye problem they might be having?
So my final advice to everybody is, once you have an eye problem, don't go to the local chemist, don't go to the local pharmacy, don't go traditionally, just go straight to where you see a specialist eye doctor so that he makes a diagnosis. You might think it's expensive, but compare that with blindness. It cannot be comparable. You understand? So just go straight to see a specialist. I've had people who made that kind of wrong decisions over the years. Eventually they get blind. And in this present dispensation we are,
Yes.
everybody is busy. Your children are busy. Your relatives are busy. Everybody is busy.
Yes.
I see a lot of elderly patients and they say, in our own time, we were around to take care of our parents, our grandparents.
Yes.
But in these days, I can't lose my eyesight because nobody's around me to take care of me. So that's my final advice to everybody. No matter how small the eye ailment, go and see a specialist.
Thank you very much, Doctor. Thank you very much.
Thank you.
It's really a wonderful discussion with you. I really hope, or I wish we had more time. We would have talked more. Here we come to the end of the program Health Talk on Al-ansar TV. And today on the program we have been discussing with a consultant ophthalmologist. Join us again same time next week for another interesting edition of the program Health Talk. I remain yours, Tahir Musa Naggo. Thank you.